Hi, I'm Dr. Jose Pignon, Chief Medical Officer for American Senior Communities.
And I'm Monica Larigi, the Director of Pharmacy for American Senior Communities. We at ASC are very excited that the US FDA has approved the COVID-19 vaccine. We are working as quickly as possible to offer the vaccine to all of our residents and staff.
We understand you may have a few questions about the COVID-19 vaccine, so we wanted to take a few minutes to address some of the questions we have been hearing. Most of the common short-term side effects of the vaccine are similar to every other vaccine. You can get injection site pain, redness and swelling, sometimes even some muscle aches and pains, headaches, or even a low-grade fever. But most of these actually go away within 24 hours. In very rare circumstances, they may last up to 48, but again, that's not usually the case. In terms of long-term side effects, this vaccine is still too new for us to be able to tell for sure. However, it is important to note that vaccines in this country have had a very long safety track record. As a matter of fact, the more important question is, what about long-term side effects if you get COVID-19? There are many disabilities that have been reported from patients that get infected. That is, if you survive the disease.
During its clinical trials, this vaccine was taken by 40,000 individuals. They found it to be safe and effective. Long-term care has been prioritized to receive the vaccine because we have the most vulnerable of all the healthcare population. And while you have the right to wait, understand that waiting puts you at risk for contracting the COVID virus. And that's a real risk to you and your loved ones. Also understand that waiting delays our country's recovery. I know, for example, we're all tired of wearing masks and not being able to hug our loved ones. And if you want to return to normal soon, we have to do our part. You have to get the vaccine sooner rather than later.
So while it is true that you may get antibodies after recovering from COVID-19, the problem is we don't really know how many antibodies you do have. For example, if you've just had mild disease, you may have just a little bit of antibodies, whereas somebody who is sicker and in the hospital and recovered may have a lot more antibodies. So when we do a standard vaccination dose, we make sure that we give enough vaccine so that your body makes a good amount of adequate antibodies to combat this disease. Okay, this new vaccine brings new hope in the fight against COVID-19. Victory through vaccination. Give me a V.
Give me a V.